think all of us are aware that we carry too much baggage. We carry too much fear, too much worry, too much of our past, fear of the future.
Somebody can put on a huge show of gaiety and it's not real.
When one person steps out and asks for help, that's the start of it.
Family therapy, which is also called systemic psychotherapy, is a therapy that focuses on relationships.
Family therapy generally is seen as working with families, and that's an important part of what we as family therapists do. But it's not only working with families, it's also working with couples and working with individuals.
Family therapists will see individuals, and a lot of the time they will work with that individual very effectively in terms of their family relationships, but the whole family doesn't need to be there.
It's a very common experience that one part of the couple will come for therapy and the other person doesn't want to come. So we would work with that one individual in trying to help the other person perhaps see the benefits, but to try and understand why they're not coming and how to see it from their perspective, thereby making it a safe place for them to come at some point. And very often they do.
I think a lot of time I probably would have been reluctant to go into therapy, from that standpoint of stubbornness and I'm not taking the blame here, but it's not really about blame and who's at fault. It's just really more about, two people working out where the issues are actually arising from and giving a solution.
What a family therapist does is try to understand what is this problem in terms of the overall relationships in the family. What is this problem trying to tell us about communication patterns?
I think that we wouldn't have survived had we not gone to therapy.
I think it's very common to be afraid to first go for therapy. So the hardest step is to make the phone call.
In a first session, it's a get to know session. The therapist will try and get to know the person who's there or the people who are there, figure out what is their main concern.
And then after that first session, when the fear is gone and you feel comfortable in the environment, then going in and actually saying it as it is for you and allowing yourself to be upset if that's what you need to be, or be angry or whatever it is, and then actually feeling yourself moving on from that because you verbalised it.
I think that people mustn't be afraid. You're going to talk to somebody who will be very discreet, very private.
No judgment.
No judgment.
By changing yourself or your response to others, then you create a shift and a change in other people. And it might even be a change in your attitude or your behaviour or your understanding. And it's often very successful.
I think people go for counselling and therapy when they see that they're repeating a problem over and over again, or they're in an upsetting situation that is really bothering them.
At the moment, what I see a lot of is people coming with difficult relationships at work. Perhaps their boss is difficult, their colleague is difficult, and they're finding they're digging themselves into a hole.
Systemic and family therapy are very effective with many issues, some of them with mental health issues, such as depression, bipolar disorder, psychosis, eating disorders, but it would also be very effective with any marital issues, separation.
I think it would alleviate an awful lot of problems that go on for people that they just struggle with and feel like it's just black, because it doesn't have to be that way. It really, really doesn't.
The Family Therapy Association of Ireland it's an association of 300 members of registered family therapists who've gone through professional training in family therapy. It's a total of 7 years training with their primary degree and then 4 years professional training afterwards.
Clients would know then that these people have undergone a particular standard and have a lot of experience behind them.
And one of the really good things about the family therapy training is that it takes place in a very, very transparent way. That the way the clinical training is set up, the family therapist is in working with the family, but they're always being observed by a supervisor and a team of family therapists.
The Family Therapy Association of Ireland has issued a code of ethics, which are the regulations that family therapists are bound by.
They monitor the accreditation, the ethics, the complaints and the professionalism of all psychotherapists. So it is there as a resource for members, it's there as a resource for the public. It's very friendly and helpful. The phone will be answered, or you can send an email, and it tries to really open things up and demystify some of the things that maybe psychotherapy sets up. very easy ways of getting therapists. The main thing you do is you look up an accredited website and you find an accredited member.
The Family Therapy Association of Ireland's website has a list of registered people as well.
But the obvious path would be through your GP and probably through a website. You could also look up the Golden Pages.
People often ask, how many sessions will this take? And I think it depends on the job that needs to be done.
But for many people, we're looking at probably the average would be 5 to 8 sessions.
There is no direct answer, but compared to other modalities or other therapies, it would be quite short term.
The general cost of sessions will vary depending probably on country or city.
Generally speaking, therapy sessions would cost between 60 and 100 euros per session.
Very often people will charge employed people a certain rate and then perhaps give a percentage off if you're unemployed.
The benefits of therapy, particularly family therapy, is that really people can usually find that they're able to converse more effectively with their family members.
A good result from therapy would be that communication improves and the relationships become a little easier.
It just gives you clarity on your journey through life.
A good result out of therapy is that people feel lighter, more in control of their lives, happier with where they're at, and a feeling of self-awareness and that they can take action on behalf of themselves.
Some of the young people say to me is that they feel more confident in themselves. They feel that they're able to maybe talk to their family or talk to their school.
A lot of people will tell me that having been to therapy is not what they expected.
I think there's also a lot of humour in therapy. It doesn't get talked about too much. As maybe the problems subside, there's a lightness about it.
Therapy is just a norm. It's the same to me as going, if I have a toothache, going to the dentist. It's the same for me to go to you or go to a therapist as it would be to walk in the door of anyone and book an appointment with any professional. It's taking care of the inside of me.
A lot of people say, I wish I'd gone earlier. I wish I'd done this years ago.
And I think it's probably the single most important thing anyone would do for their relationship. You know, it's not a dress rehearsal, this life.
People will say to me that they're surprised at how light they feel on the way out, and that's perhaps for them very surprising. They weren't expecting that. They feel unburdened, and that's a very nice thing to feel.